Hi, welcome to my corner. This is Accurate ID on TikTok, Nurse ID on YouTube, and Idongese Thomas on Facebook. Have you ever seen someone with a swollen, red, painful, and warm leg? Yes, it may not really show on someone with dark skin. It's more profound on a white skinned person, but you will still see on a black person if you look well. And if somebody complains about that, it is not what a lot of people believe it is, like matching of poison, juju, and so on. No, it is a medical condition that is treatable, preventable, and can even be cured. Yes. So do not go and complicate issues for yourself. And do not massage. What did I say? I reiterate. Do not massage any swollen leg, red and warm. Especially if it affects one leg, that affected part is warm, while the other side, there is no issue. It's a very cardinal sign of what is called deep venous thrombosis. What is deep venous thrombosis? It is a condition whereby there is blood stasis in the lower limb. It can occur in the upper limb, elsewhere, and so on. But majority of the time, it occurs on the lower limb. So, what causes this stasis? There are different causes, like prolonged period of sitting. When someone sits for a long time, blood return is diminished. So that stasis of blood down can result in clotting, which may complicate the condition. So it is recommended that you move about every 1 to 2 hours. Avoid prolonged sitting. Another cause could be surgery, especially hip, leg, and abdominal surgeries. Anybody that does that kind of surgery is at risk for deep venous thrombosis. That is why, if it happens in a good setting, the person is placed on anticoagulants 6 to 8 hours after the surgery. And anywhere you go for surgery that is not done, if you go for hip, abdominal, or any leg surgery that is not done, it is an error. So another cause could be trauma, someone being on bed rest for a long time, someone having chronic sicknesses that makes you stay on bed, you can't even move, like heart failure, cancer, and so on. Then chronic sickness. Okay, I mentioned chronic sicknesses. Pregnancy is also one of the major causes of deep venous thrombosis, in the sense that the weight of the uterus or the pelvis can block blood from returning. So that stasis can cause blood to clot. Another condition called varicose vein can also cause age, is also a factor. Smoking causes some problems with clotting. Yes, so that is why it is advisable not to smoke. Smoking can cause so many health issues. So if you can avoid it, it's very good. Then some bed pills, not all, some of the bed pills can cause someone to be at risk for blood clots, yes, in the lower limb. So that is it. Then family history, also genetic disorders. Some people have this disease that their DNA causes some issues with clotting, so they're also at risk, and so on. So what it is that you can do to prevent this condition: you walk every 1 to 2 hours, as I earlier said. Avoid sitting down for too long, especially when traveling, no matter the mode of transportation, either air or land. You avoid sitting. From time to time, you stand up, move about. If you cannot move, just stand up from where you are. Let there be blood flow, returning. And then you sleep on the side if you're pregnant. Avoid sleeping on the back. Avoid any posture that will cause so much pressure down there. Side is more advisable. Compression stockings can also be used, like those traveling for a very long distance. You can wear the compression stocking. Then avoid smoking. Alcohol excess is not good. Reduce weight. That weight causes pressure in the vein of the lower limb, so that is for the prevention. Then for intervention, if this thing occurs, the intervention is that somebody can be placed on what is called anticoagulants. These are drugs that helps to prevent clotting. So what this anticoagulant does is that it will not break clot, but it will only prevent further clotting that may complicate issues. So as we are giving time for the ones that have clotted already to dissolve, anticoagulants will help prevent further clotting. And mechanical compression, which is pneumatic stockings or compression stockings. Pneumatic stockings are those ones used in the hospital when somebody is on bed. They tie on the two legs. It pumps and relieves, pumps and relieves. That one is far better than the other stockings, because as it pumps and relieves, it allows blood flow, far better than the stockings that is always tight. So that is that. The major cause of DVT is blood stasis. So how can you prevent blood stasis? Is by being active. However, if someone develops this condition known as DVT, you don't need to massage. Do not massage. So thank you very much. I know you have learned one or two things. Stick around with me. I am going to give you the secrets to good health.